Have you ever walked out of the store and had no idea where you left the car, then thought, is this just aging or is something more serious? That question matters more than ever. Today, many older adults take several prescriptions each day, sometimes 5 or more. And in some reports, nearly 1 in 4 seniors are prescribed 10 or more drug classes. That much medicine can sometimes puzzle more than just the pill box. In this video, you'll learn how to separate normal aging from substance-related memory problems and see practical steps to protect your brain health. Why so many pills, so many problems? So why do so many older adults find themselves on long medication lists? And why can that become a problem? The answer lies in polypharmacy, taking multiple drugs at the same time. Seniors often see several specialists, each focused on treating one area: a cardiologist for the heart, a rheumatologist for the joints, a psychiatrist for mood, a primary doctor tying things together as best they can. Each prescription may be reasonable on its own, but together they can pile up. And sometimes older prescriptions never get removed even after they're no longer necessary. Research shows that many seniors routinely take 5 or more medications, and a significant number take 10 or more. This accumulation increases the chance of drug interactions, confused dosing schedules, and side effects that affect thinking and memory. The body itself also begins to handle medicines differently with age. Studies make it very clear. As people get older, liver and kidney function slow down. These organs are vital for clearing drugs from the body, so when they work at a reduced pace, medicines remain active for longer and at stronger levels. A dose that might sit comfortably with someone in their 30s can cause grogginess, dizziness, or confusion in someone decades older. This isn't a mystery, it's a predictable physiological change, and it explains why even standard treatment routines can start to feel overwhelming for seniors. These two realities, multiple prescriptions and slower clearance, combine to create an environment where cognitive side effects are common. Many clinical reports describe situations where older adults showed dementia-like symptoms that improved once their medication lists were adjusted. In composite cases documented across the literature, simply changing or reducing overlapping drugs often clears the fog. That's why side effects deserve just as much attention as age itself when memory lapses appear. Because of this, doctors and pharmacists encourage practical steps to reduce risk. One well-supported approach is a brown bag review, where a patient brings in every pill bottle they use, prescription, over-the-counter, even supplements, so the healthcare team can see the full picture at once. This process helps to catch unnecessary duplications, spot risky interactions, and simplify medication routines. Families can also help by keeping an up-to-date, written list of every drug being taken and sharing it at appointments. It's a small action, but it can make a big difference in whether symptoms are blamed on age versus adjusted through safer prescribing. Understanding polypharmacy doesn't eliminate the need for careful monitoring, but it does give us one more way to explain why confusion or forgetfulness might appear suddenly. And when you know there's a possible fix, the situation feels less frightening. Still, even with good medication management, memory slips do happen, and not every mistake means something serious. The real challenge is noticing when those slips fit a normal pattern and when they fall outside the usual. Spotting early warning signs without panicking. Memory slips don't all carry the same meaning, and the key is recognizing which ones deserve closer attention without slipping into panic. Spotting early warning signs is really about contrasts, what looks like an ordinary lapse versus what signals that something more concerning may be at play. Take names, for example. Many older adults know the tip of the tongue moment when a familiar name just won't come immediately, but usually it pops back within a few minutes. That's perfectly normal. By contrast, struggling to recognize a longtime neighbor or forgetting who a close family member is goes beyond aging. That's a warning sign worth noticing. Daily routines show similar differences. Forgetting to pick up milk from the store is a common, harmless mistake. But being completely unaware that a shopping trip was ever planned in the first place, or insisting it never happened, points toward trouble with forming or storing memories. Recognizing these shifts doesn't mean assuming the worst. It simply helps families understand when the pattern of forgetfulness suggests something more than distraction. Orientation is another important difference. Ordinary distraction might look like walking into a room and not remembering why you came in, but you still know exactly where you are. More concerning is when someone feels lost in their own living room or suddenly cannot recognize their surroundings. Research shows that sudden changes in attention and orientation are more consistent with delirium, which can be triggered by substances or medications. While not every case is an emergency, this kind of disorientation warrants timely evaluation since it often points to a reversible cause. Because isolated slips don't tell the whole story, the real insight comes from tracking patterns. A simple, practical method is journaling. Just one notebook is enough. Each time confusion comes up, note the date, time, what was happening, along with any medications or alcohol used that day. Over days or weeks, clear patterns often emerge. Maybe forgetfulness always follows use of a sleep aid. Maybe it happens only during stressful family events. These concrete notes create a timeline that both seniors and doctors can work with, transforming scattered worries into actionable evidence. Keeping notes also reduces fear. Without a record, every lapse can feel like proof of decline. Families may panic after a misplaced wallet, assuming it marks the first step of dementia, when in reality it may just be a random slip. But when notes show that lapses consistently occur right after certain medicines, or that they don't repeat at all, the picture changes. Instead of guessing, you have patterns that guide what to do next. It helps to keep the conversation gentle. Instead of telling a parent, "You keep forgetting things," a calmer question might be, "Do you notice certain times when memory is harder?" That kind of framing invites collaboration rather than criticism. And most people respond better when they feel supported instead of judged. Humor also has a place here. Laughing about searching for the TV remote only to find it sitting on the couch cushion is healthy. It keeps worry from taking over. What matters is knowing where to draw the line. Forgetting the remote itself is minor, but forgetting what it's for points to something that needs attention. These observations are less about catching decline and more about collecting useful clues. The brain leaves trails when something is off, and those trails often match up with medication timing, dosages, or interactions. Normal aging usually brings slower recall and more distraction, but it doesn't cause sudden confusion about place or identity. When the signs don't fit the usual pattern, there's often an underlying factor that can be adjusted. With this perspective, seniors and families don't have to panic over every misplaced item or skipped appointment. Most lapses are ordinary and manageable. The practical focus should remain on whether forgetfulness disrupts orientation, changes relationships with familiar people, or consistently follows certain substances. Watching for those signs equips families to step in calmly without jumping to worst-case scenarios. The goal isn't to deny that memory challenges appear with age. It's to respond to them with clarity instead of fear. Tracking symptoms, keeping the tone light, and knowing which warning signs matter turn uncertainty into manageable steps. Often, once patterns are clear, seniors can bring the evidence to a healthcare provider who may find simple medication changes or adjustments make a large difference. And that leads us to the next question many people have. If ordinary medicines can sometimes create these problems, which ones are most likely to cloud memory? The answer may surprise you, especially when you take a closer look at the familiar bottles often sitting on the kitchen counter. The surprising prescription drugs that can cloud memory. When people worry about memory loss, they often think about aging itself. But the reality is that certain prescription drugs are among the strongest contributors to cognitive fog in older adults. Some of the most familiar medications used daily for sleep, allergies, or pain are linked with confusion, forgetfulness, and slower thinking. Research makes this clear. Long-term use of drugs with anticholinergic effects and benzodiazepines has been associated with a higher risk of cognitive decline and dementia symptoms. These are not minor findings. They come from large-scale studies reviewed by neurologists and published in respected journals. Knowing which medication categories to watch is an essential step toward keeping the brain clear. For simplicity, it helps to group these medications into 3 broad buckets. The first includes sedatives, such as benzodiazepines, and a related group known as Z-drugs, prescribed for anxiety or insomnia. While they calm the nervous system, they also blunt alertness and interfere with short-term memory. Many older adults describe feeling groggy the next morning, still under the influence despite a full night's sleep. That haziness often raises concern about dementia when, in fact, it is a medication side effect. The second group includes drugs with anticholinergic effects. These are surprisingly common and include first-generation antihistamines for allergies, some antidepressants, and medications used for bladder control. They work by blocking a key neurotransmitter, acetylcholine, which the brain depends on for attention and memory. In younger people, the impact may be modest, but in older adults, the effect is far more noticeable. Studies consistently show that a higher anticholinergic burden is linked with confusion, difficulty focusing, and memory lapses. That is why clinicians often reference the Beers criteria, a guideline designed to highlight which medications are riskier for seniors, and they encourage patients to ask questions about their own anticholinergic load. The third group is opioids and other strong pain medications. These drugs alter the brain's perception of pain, but at the same time, they also diminish concentration and reaction time. An older adult taking these drugs regularly may drift into drowsiness during conversations, struggle with attention, or seem slower to recall details. These symptoms can be misread as progressive decline, even though they are reversible once doses are adjusted or alternative pain strategies are used. The reason these effects intensify with age isn't just about the medicine. It is about the body's changing ability to process what goes into it. Liver and kidney functions, which act as natural filters, slow down in later years. A standard dose that once wore off in 10 hours may circulate for much longer, stacking up day after day. The result is a steady cloudiness that families often mistake for permanent deterioration, when it is actually the byproduct of slower metabolism. What makes this more complicated is that symptoms accumulate gradually, making them easy to misattribute. A senior may have started on a low dose for sleep years ago without trouble, but as new medicines are added, perhaps an antihistamine for allergies or an opioid after an injury, the combined cognitive impact builds slowly. Even though each drug on its own may be reasonable, together they cross a threshold where alertness and memory falter. Clinicians often describe cases where memory loss appears dramatic, but improves quickly after medication adjustments. In fact, this scenario is common enough to be widely recognized in research and medical practice. Typical situations involve older adults who repeat themselves in conversation, forget familiar names, or show morning confusion. Families often assume early dementia and come in worried. Careful medication reviews, sometimes called brown bag reviews, reveal overlapping sedatives, anticholinergics, or pain medications. Once doses are reduced, timed differently, or switched to safer options, the fog clears within weeks. This shift illustrates how easily memory symptoms can be misinterpreted if the medication factor is overlooked. Understanding these categories of drugs doesn't mean they should never be used. Many provide important benefits that improve quality of life. But it does mean that constant reevaluation is necessary. if memory issues surface suddenly, asking about medications is a practical first line of defense. Patients and families who know which drug classes affect cognition are better equipped to ask the right questions. A simple prompt such as, "Could any of these medicines contribute to forgetfulness?" can help redirect both doctors and caregivers toward possible answers. Another practical point is timing. Even small changes in when a drug is taken can influence alertness. A sleep medication used late in the evening may carry over into the next morning, while the same dose taken slightly earlier could wear off sooner. Similarly, daytime use of antihistamines increases the chance of haze during hours when concentration is most needed. Recognizing how schedule interacts with side effects can sometimes solve problems without having to stop a medicine altogether. It's also important to remember that medication side effects don't always mimic dementia in obvious ways. Some people report being unable to follow a conversation, not because they can't remember words, but because they can't keep attention focused long enough to process them. Others describe lapses in judgment, like forgetting to turn off the stove or missing bill payments despite long-standing habits of reliability. These changes often reflect slowed brain processing rather than the irreversible neuron damage of true dementia. Spotting the difference relies on carefully looking at when symptoms began and how they connect to the use of medications. This is why healthcare providers warn against evaluating memory loss in isolation. A new symptom is not always the start of a chronic disease. Sometimes it is the body signaling that the current load of medications is too heavy for the brain to handle smoothly. The good news is that, in these cases, recovery is often possible. Adjustments may bring back alertness, restore confidence, and offer reassurance that memory trouble does not always signal decline. Families who learn about these three buckets of risk drugs, sedatives, anticholinergics, and strong pain medications, start to see patterns that were hidden before. That awareness reduces unnecessary panic and supports clearer communication with physicians. Even asking a doctor if a particular drug is on the Beers list or contributing to anticholinergic burden opens the door to safer prescribing choices. Ultimately, the important message here is that prescription drugs can be powerful influences on brain health, both helpful and harmful. The line between relief and risk becomes thinner with age, but being informed shifts control back toward patients and families. Instead of assuming the worst when memory falters, you gain a practical lens to interpret what is happening. Of course, medications are not the only substances that affect how the brain functions in later years. Another influence comes not from a prescription, but from daily habits around relaxation and leisure. And while it often begins as something simple shared with friends or family, its long-term impact on brain health can be just as significant. Alcohol, friend at parties, foe in the brain. Alcohol carries a unique role in discussions of memory and aging. It is often seen as a casual companion, social at gatherings, soothing in routines, yet it can act as an unrecognized driver of confusion and memory loss in later life. While many adults think only heavy drinkers face risk, the evidence shows otherwise, according to the National Institute on Alcohol Abuse and Alcoholism. Over half of people aged 65 and older reported drinking alcohol in the past year. For a younger body, a drink may burn off quickly, but for older adults, slower metabolism and body composition changes make even modest drinking more potent. What looks like just one may hit the brain as double or more, carrying consequences that build silently over time. The growing prevalence of alcohol use among older adults reflects more than habit. Retirement, shifting routines, and widespread cultural acceptance of alcohol as a relaxation tool all contribute to why so many continue to drink well into later life. Some describe it as a social bond, wine with friends, a toast at dinner, or part of group traditions. For others, it becomes a solitary nightly ritual, something that feels like a comfort or reward at the end of the day. Regardless of the reason, Regular alcohol consumption in later life brings cognitive and neurological risks that families often misinterpret as age-related decline. Recognizing the effects matters, especially when early warning signs look nearly identical to progressive dementia. One of the best documented effects of long-term alcohol use is structural change in the brain. Older adults already face normal, age-related brain volume loss, but alcohol exposure can accelerate shrinkage in areas tied to memory and problem-solving. Families often observe slower recall, weaker attention, or blunted decision-making, and assume these are natural signs of Alzheimer's or vascular dementia. In reality, the changes often trace back to alcohol. Importantly, studies on alcohol-related brain disorders, sometimes referred to as ARBD, show that symptoms are not always permanent. Many people who stop drinking experience partial or even full recovery in cognitive function. That finding underscores an essential point. Alcohol-related memory issues may not be a fixed sentence, but a problem that improves when intake stops. Alcohol's impact goes beyond brain structure and extends to nutrition, particularly vitamin absorption. One critical nutrient affected is thiamine, vitamin B1, which supports normal nerve and brain cell function. Without enough thiamine, confusion, disorientation, and profound forgetfulness may occur. In extreme cases, chronic deficiency tied to alcohol use can result in serious syndromes that mimic severe dementia. The hopeful side is that with supplementation and reduced drinking, many symptoms improve. Yet, the obstacle is recognition. Families often assume these alarming changes represent irreversible decline rather than preventable nutritional disruption. Cerebrovascular health is another piece of the puzzle. Alcohol raises blood pressure, disrupts circulation, and increases stroke risk. Even minor strokes, sometimes called silent strokes, can accumulate and degrade cognitive performance. The effect may appear as subtle slurring of speech, clumsiness, or difficulty recalling words that once came easily. Over time, these small events compound into noticeable deficits. While dementia is often suspected, the underlying culprit may be circulatory injury worsened by alcohol use. With good medical care and a reduction in drinking, stroke risk can be lowered, protecting brain function in turn. Beyond long-range effects, the interaction between alcohol and medications deserves emphasis. Many seniors already take prescriptions for blood pressure, sleep, anxiety, or pain management. Alcohol magnifies side effects of these drugs, often unpredictably. An evening drink layered onto a sedative can trigger far heavier disorientation than expected. A dose of pain medication paired with alcohol may tip balance into dangerous territory, sometimes leading to falls or emergency visits. These incidents are not only frightening, they also deepen confusion in families who may interpret the episode as sudden dementia rather than a chemical overload in the body. One critical safety point is withdrawal. While some assume stopping alcohol use is simple, research warns that sudden withdrawal can be medically dangerous, even life-threatening. Risks include seizures and delirium tremens, conditions that require urgent care. For seniors accustomed to daily drinking, medical supervision is strongly recommended during detox, giving the brain and body a safer path to recovery. The encouraging perspective is that the brain carries resilience even in later life. Recovery from alcohol effects often begins quickly once drinking stops. Seniors who reduce or end alcohol use typically notice clearer mornings, steadier moods, and more reliable short-term recall within weeks. Longer-term abstinence correlates with stabilization of brain volume loss and measurable improvements in cognitive performance. It is not uncommon for older adults once believed to have progressive decline to regain independence after alcohol use is addressed. The message is straightforward. Symptoms linked to alcohol do not have to be permanent. Practical framing helps when addressing the issue within families. comparing a nightly drink to a prescription emphasizes clarity. For an older body, the same dose has a stronger effect than it did decades earlier. What once felt harmless may now create memory gaps, confusion, or balance problems. Families who approach the discussion through health and safety, not moral judgment, see better results. Highlighting independence, clear thinking, or reduced hospital risks reframes quitting or cutting back as empowerment rather than loss. Many older adults respond positively when their choices are presented in this light. Conversations about cutting down face social barriers. Alcohol is rooted in traditions, holidays, dinners, and rituals of relaxation. Suggesting change can feel like intruding on something personal. But with knowledge of alcohol's outsized impact on aging brains, these discussions become acts of care. Offering alternatives, such as non-alcoholic beverages or lowering frequency, keeps social connection intact while protecting long-term health. What may feel like a small substitution can significantly reduce risks of falls, confusion, or worsening memory. Moving forward does not always require absolute abstinence. For some, occasional drinking at special events remains safe when balanced with awareness and healthy routines. The greater concern is daily use or consistent patterns, where the risks accumulate silently. Families who notice new lapses in recall or episodes of disorientation do well to ask one practical question. Could alcohol be playing a role here? This simple consideration can guide doctors in assessments, preventing premature assumptions about permanent decline. The crucial distinction lies in reversibility. Unlike Alzheimer's disease or other degenerative dementias, alcohol-related brain changes may resolve with intervention. Some symptoms fade within weeks, others over months, but the potential for improvement changes the landscape of what aging looks like. For seniors concerned about memory, alcohol is not just a social choice, but a medical factor tied directly to brain clarity. By confronting its role, individuals gain a stronger grasp on what is temporary versus what signals lasting disease. This pattern of misinterpretation, mistaking reversible, substance-driven memory issues for permanent dementia, recurs across cases. Families, uncertain of the cause, often panic when confusion or memory loss appears suddenly. Yet under closer evaluation, the timeline reveals key clues about whether the issue stems from substances or a progressive disorder. Understanding how to sort between those two possibilities becomes the next step, and it begins with asking where, when, and how memory problems first appeared, differentiating true dementia from substance-induced symptoms. When memory problems appear, one of the greatest challenges is deciding whether they stem from a medical illness like dementia or from the effects of substances such as medications or alcohol. At first glance, both can look very similar. Someone may repeat the same questions, forget where they were headed, or struggle to follow conversations. Families often assume dementia because it is the diagnosis most people fear with age. Yet doctors rely on a deeper analysis of timing and pattern before making that conclusion, and the difference can be life-changing. Research reviews suggest that drug-induced cognitive issues may actually account for an estimated 2 to 10% of dementia-like cases. That means a meaningful slice of people thought to be slipping into permanent decline are instead experiencing effects that could be modified or reversed. Understanding how to notice this distinction gives families both hope and a practical framework to use when they're uncertain. The timeline of symptoms is the key feature doctors use again and again. Decline from Alzheimer's disease or other dementias unfold slowly, spreading over months and years. Early signs are often subtle, difficulty finding words, misplacing items, narrowing interests, and they advance in a steady, irreversible curve. Substance-related impairment, by contrast, is far less consistent. It can arrive suddenly after starting a new pill, adjusting a dosage, or drinking heavily for several days. Some people worsen sharply after an abrupt stop in alcohol use. as withdrawal causes delirium or disorientation. And unlike dementia, these symptoms may fade or improve when the substance use changes. For families trying to sort this out at home, it helps to follow a simple 3-part checklist. First, ask, did the problem begin suddenly or has it crept in gradually? Second, consider, did it appear after a change in medicines, drinking habits, or an attempted detox? Third, observe, do things improve when medications are stopped, adjusted, or when alcohol intake is reduced? These 3 questions, onset, relation, and improvement, form an easy guide that lays the groundwork for doctors to evaluate whether the cause looks more like true dementia or substance-related changes. Picture a case where someone begins a new pain medication, and within days, their family notices confusion around daily tasks. The rapid change and clear timing would raise suspicion of a drug effect. By contrast, someone who has been slowly losing language ability and independent judgment over several years, despite careful review of their medications, fits the pattern of a progressive disease. In one, recovery is possible. In the other, the trajectory is steady decline. That difference makes close attention to timing invaluable. Another way to visualize it is through how symptoms change over time. Imagine drawing a line on a chart. True dementia tends to slope steadily downward, rarely improving no matter what adjustments are made. Substance effects often zig and zag, clear some days, concerning on others, sometimes better once a medicine is removed. This uneven pattern is one of the strongest signals that the underlying problem may not be permanent. Families who keep even modest notes about when lapses happen and what substances were in use provide doctors with exactly the kind of information that distinguishes these patterns. It is not necessary to keep exhaustive journals. What clinicians value most are 3 concrete pieces of information: a current, accurate list of all medications and supplements, including over-the-counter items, the specific timing of when confusion or lapses began, and any recent changes in alcohol use or attempts to quit drinking. These details equip physicians and pharmacists to spot interactions, unintended side effects, or withdrawal effects that might otherwise be mistaken for degenerative disease. A neatly written list of pill names, doses, and behavior notes often illuminates patterns far faster than memory tests on their own. Consider Joan, who began forgetting where she parked only after starting a new blood pressure prescription. The clear timing pointed doctors toward the medication, and once it was adjusted, her memory gaps lessened significantly. Without that context, she may have carried a mistaken label of dementia for years. Frank, on the other hand, showed a slow erosion of language, problem-solving skills, and interest in activities over several years. The steady march across multiple brain functions, persisting even after medication changes, confirmed dementia rather than substances as the underlying cause. These contrasts illustrate how the same outward signs can point in different directions depending on history and trajectory. Families sometimes struggle most with managing their own worry. Watching a parent forget a familiar name or misplace items repeatedly is alarming, and fear of dementia often rushes to the front. But stepping back to connect lapses to timing is more useful than reacting in panic. Did the repetition start just after a sedative was prescribed? Did confusion spike after a few nights of drinking? Or does it occur regardless of outside factors, creeping steadily through everyday life? Families who ask these questions arm themselves with insights rather than assumptions. Doctors, for their part, can only see a snapshot during visits. Memory screenings may highlight impairment, but those tests cannot sort whether impairment is caused by progressive disease or a temporary influence without the broader context. That is why families' observations and written records hold so much weight. Shared timelines bridge the gap between what is visible in a clinic and how symptoms unfold at home. One practical reminder is that reversible causes are not rare. the proportion of dementia-like conditions linked to drugs or alcohol is small but significant, and it represents real opportunities for better outcomes. When families hand over clear medication lists, symptom timing, and alcohol histories, they directly support doctors in recognizing these opportunities. The result may be a safer prescription plan, advice on reducing intake, or guidance towards supervised detox if needed. Each of these can restore clarity in ways that otherwise might have been missed. Ultimately, the distinction between dementia and substance effects rests on watching for suddenness, looking for links to external triggers, and noting any tendency toward improvement once those triggers are removed. Families that adopt this simple framework help both themselves and their doctors avoid mislabeling reversible states as permanent disease. Instead of despair, the process opens the door to recovery for some and accurate diagnosis for others. But even with clear patterns, the next hurdle often lies in how these concerns are discussed at home. Families may discover connections between nightcaps, sleep aids, or new prescriptions and memory lapses, yet struggle with how to raise the issue. And while gathering information is one step, delivering it without conflict is another challenge entirely, especially when it touches on habits and choices that hold deep meaning for a loved one. Family conversations without conflict. Family conversations about habits tied to memory lapses often feel like the hardest part of dealing with substance-related symptoms. This is where emotions run strong, where words can land wrong, and where relationships can either strengthen or strain. Families often mean well, yet the way something is phrased decides whether the discussion opens a door or builds a wall. With sensitive topics like alcohol or prescriptions, success comes less from forceful arguments and more from subtle adjustments in approach. One of the simplest shifts is reframing blame. When the concern sounds directed at the person, defensiveness rises quickly. But when the focus is redirected toward the medications, the mixtures, or the chemical effects, the discussion feels less personal and more collaborative. Instead of saying, "You're forgetting everything," a calmer option is, "It seems like the medicine is making your memory fuzzy." The difference is small but powerful. Research confirms that collaborative language, where the problem is defined as external to the person, encourages openness, while accusatory framing makes change less likely. Tone also matters as much as the message itself. A sharp critique like, "You're not making sense lately," feels final and judging. A gentler observation such as, "I've noticed you seem tired in the evenings. I wonder if the medicine plays a part," leaves space for dialogue. Seniors want to preserve their autonomy, and they are far more willing to listen when conversations are framed around supporting that independence. Saying, "We want to help you keep driving safely," signals respect for what matters most to them, rather than highlighting deficits. Active listening is another key element. Many conversations collapse because family members arrive with a speech rather than a question. Instead, inviting the senior to describe their own experience creates space to share frustrations or side effects that may have gone unnoticed. Asking, "How do you feel the morning after taking that pill?" Or "Do you notice if your evenings feel foggier on some days than others?" makes the discussion interactive. This shift from lecture to dialogue keeps dignity intact and increases the chances of mutual problem solving. Humor can be useful, too, provided it respects the person. Light comments that shift blame onto tricky pill bottles or complex schedules help soften the mood. A joke about how those little tablets are sneakier than they look diffuses tension because it makes the situation the culprit rather than the senior. Families should avoid humor at the elder's expense, but observations about the messiness of managing. Multiple medications can bring laughter while keeping dignity in place. This sense of being all in it together works better than confrontation. Because these discussions can feel overwhelming, having a clear, simple checklist helps families remember what to emphasize and what to avoid. 4 steps are particularly effective. Lead by expressing concern for independence. We want you to keep cooking those meals you enjoy. Point to the substance, not the person. The pills may be adding to the confusion. Ask gently about bringing a clinician or pharmacist into the conversation. Could we ask the doctor about this together? And offer to accompany them to the appointment. Would you like me to go with you? These phrases sound supportive rather than controlling, and families can rehearse them mentally before raising the topic. Research also highlights the importance of professional support in moving forward. Pharmacists, in particular, play a central role in reviewing medications. Evidence shows that pharmacist-led brown bag reviews often uncover duplications, interactions, or unnecessary prescriptions. Families who encourage seniors to schedule such a review by literally bringing every pill bottle to the doctor or pharmacist gain clarity and open the door to safer alternatives. Geriatricians also emphasize deprescribing, a thoughtful process of scaling down medications when possible. Encouraging loved ones to ask for a formal medication review provides credibility and reinforces that the conversation is about health and safety, not blame. Role-play style examples can help families practice. Instead of long stories, short sample lines are enough to demonstrate tone. A confrontational version might sound like, "Dad, your whiskey is ruining your memory." The cooperative version softens this. "Dad, I wonder if that nightcap and your medicine together are leaving you groggy. Should we ask the doctor?" In practice, the second version lands more gently because it points to the combination, not the individual. Short, practiced responses like these reduce the chance of arguments escalating in real time. Anticipating objections is crucial as well. Seniors often respond with, "I've been fine doing this for years." Meeting resistance with confrontation can escalate tensions, while acknowledging their perspective keeps the door open. Responding with, "That's true, you have managed it well. But since your prescriptions have changed, your body may be reacting differently," validates their history, yet still points toward the need for a new look. This balanced acknowledgement communicates respect for past successes, while framing the present issue as a new challenge. Another useful tactic is pacing. Expecting one conversation to resolve everything rarely works. Raising the issue gently, then letting time pass before bringing it up again, lowers defensiveness. Each time the concern is tied to a specific event, like a missed appointment or a confusing interaction, the connection feels more grounded. Over time, the repetition of these small reminders builds a pattern, helping the senior see the link themselves. Change is usually more sustainable when it is gradual and internally motivated rather than enforced from outside. Professional involvement also shields families from conflict fatigue. Sometimes, hearing the same advice directly from a doctor or pharmacist secures a breakthrough. Seniors may resist input from children, but respond differently when the recommendation comes from a trusted professional. Families can prepare by writing down concerns in advance for the appointment, ensuring the clinician has the full picture. This shifts the setting from a potentially charged home discussion to a neutral consultation room. Ultimately, the value of these conversations lies in maintaining trust. When families learn to reframe language, listen actively, and share responsibility with professionals, the dynamic changes from conflict to cooperation. Seniors sense that their dignity and independence remain central, while families feel relief in supporting without overstepping. The outcome is not just fewer arguments, but stronger relationships built on respect. In the real world, the tension often fades when both sides recognize they are not opponents, but allies against a shared challenge. The goal is not to catalog every forgotten item or habit, but to safeguard clarity, safety, and everyday freedoms. By treating medications and substances as the focus instead of placing blame, families create space for constructive solutions. Conversations that once ended in arguments instead become opportunities to adjust routines, explore safer options, and preserve quality of life. These approaches don't solve every problem, but they change the tone in meaningful ways. Instead of escalating disputes at the dinner table, families learn to talk in quieter, collaborative voices. Parents feel respected. Adult children feel heard. Both sides leave the conversation with the sense that independence and connection remain protected. And once family members are able to discuss these concerns without conflict, the next question naturally follows. What practical tools can help put these plans into action each day, keeping things steady and safe at home? Practical tools for medication management. Medication routines may look like small details, but they are one of the most important safeguards for protecting memory. The way pills are handled, organized, and monitored changes whether the brain functions with clarity or slips into repeated episodes of fog. Practical tools for medication management help prevent the subtle errors that so often get mistaken for serious decline. What matters is not only having the tools, but also using them in a consistent, structured way. A gold standard first step is the brown bag medication reconciliation. This process asks patients to gather every pill bottle, supplement, and over-the-counter product into one bag and bring them to a pharmacist or doctor. By laying out the entire list at once, professionals can check for drug duplications, unsafe interactions, or outdated prescriptions. Research shows that medication reconciliation, followed by deprescribing, carefully reducing unnecessary or overlapping drugs, saves many seniors from spiraling confusion or falls. It is a simple habit with outsized benefits, one appointment where the whole picture comes into view. Families can help by setting a recurring reminder for these reviews, ideally every 3 months, since prescriptions change and risks increase over time. From that essential review, 3 clear steps make medication safer at home. First, collect everything into one place with a brown bag review. Second, ask the pharmacist about supports such as blister packs, calendar-style packs, or bottles that are easier to open if grip strength is an issue. Third, set up a straightforward system, either a weekly pill box, pharmacy-prepared blister packs, or reminder apps that alert when doses are due. These steps work in sequence. Clear the clutter, request the right packaging, then build daily routines. Most families find that following this progression transforms constant uncertainty into a steady, predictable pattern. Weekly pill boxes remain one of the simplest and most reliable helpers. Each compartment holds the exact pills for a day or time of day, so opening the Tuesday morning slot leaves no question about whether the dose has been taken. A senior juggling 7 or 8 prescriptions can replace scattered bottles with one visible container. This reduction cuts down on errors such as mixing a nighttime sedative with a morning blood pressure pill, mistakes that often produce grogginess, dizziness, or sudden memory gaps. The box clears that risk with one glance. Many older adults pride themselves on filling their organizer each week, a small task that affirms independence while preventing larger problems. Pharmacies extend this idea with blister packs, sealing doses into labeled slots divided by breakfast, lunch, dinner, or bedtime. They function like a calendar. Unopened means not yet taken, empty means completed. Families appreciate the accountability, especially in households where several people help with care. A quick visual check confirms exactly what has been taken without guesswork. For seniors, blister packs reduce the effort of sorting pills each week, shifting that responsibility back to the pharmacy and ensuring doses remain consistent. Technology provides a newer layer of protection. Many seniors and caregivers now use apps that buzz or speak reminders at set times. Some connect to relatives, sending an alert if a dose is missed. This extends independence while keeping family involved, especially for those who live at a distance. Coupled with pill boxes or blister packs, digital reminders create a second line of defense, confirming that the right medication is taken at the right time every day. The need for such systems becomes clearer when thinking about what happens without them. Medication mistakes have direct neurological consequences. Forgetting a dose of blood pressure pills may lead to fainting or confusion. Doubling a sedative by accident can produce hallucinations or a full day of disorientation. Families who see these episodes often assume dementia is worsening, unaware that a skipped or doubled dose caused the change. Structuring routine through organizers or apps prevents these avoidable missteps and spares both patients and families from unnecessary alarm. One common unsafe shortcut deserves attention: pouring every pill into a single container. Seniors who find childproof caps difficult may combine medications into one bottle, hoping to make them easier to access. The result is rows of look-alike tablets that blur into one another. Yellow pain pills may sit beside yellow morning tablets, and there is no clear record of how many doses are taken. It seems convenient, but research on drug safety consistently warns against it. The risk of doubling a dose or swallowing the wrong medication is far higher, and the error rate climbs quickly once pills are mixed. Pharmacists emphasize that the safer alternative is requesting easy-open bottles or pharmacy-provided packs instead of combining pills. Small details like packaging also significantly influence safety. Easy-open lids, larger print labels, or color-coded packs may seem trivial, but they allow seniors to stay independent without slipping into shortcuts that endanger health. Pharmacists generally provide these adjustments for free if asked, and families are often surprised to learn how much difference a simple change in packaging can make. The key is asking directly, something many avoid out of habit or modesty. Once requested, the changes sharply reduce the risks of errors tied to arthritis, vision problems, or cognitive fatigue. Consistency across days produces most of the benefits. When medications are taken on time, at the right dose, and without duplication, the body maintains a steady rhythm. Cognitive side effects become predictable, sudden drops or surges in alertness vanish, and overall brain clarity stabilizes. Doctors also gain more accurate health information. They no longer have to sort whether blood pressure swings are the body's fault or the result of erratic dosing. Families notice fewer panic calls in the evening and fewer emergency visits after preventable falls. The ripple effects are broader than memory alone. One mistake with pill management can create a chain reaction. Confusion leads to a fall, the fall leads to hospitalization, the hospital adds more medications, and the medication list grows more dangerous. Tools like pillboxes and blister packs stop that chain before it starts. They act as interruption points, keeping the first error from compounding into a cycle of new prescriptions, increased confusion, and lost independence. These practices also support healthier dynamics within families. Seniors who independently manage their own pillbox often feel pride, not dependence. They know they are in control, and caregivers can confirm at a glance that routines are followed. Instead of arguments about whether a pill was skipped, the evidence sits in clear view. This shared visibility encourages cooperation rather than suspicion, preserving trust during a stage of life where self-sufficiency is deeply valued. Still, no system works in isolation forever. Conditions change, prescriptions are adjusted, and the overall burden of medications shifts with time. That is why quarterly medication reviews with a prescriber or pharmacist matter almost as much as daily tools. Research supports the process of deprescribing, carefully tapering or removing unnecessary medications, because polypharmacy rarely stays stable across years. What was safe last year may no longer be safe today. Setting a recurring schedule for these reviews ensures systems remain updated and safe. The larger lesson is that clarity in later life doesn't rely on advanced technology or complicated interventions. Often, it emerges from basic organization, repeated consistently. Plastic boxes, blister packs, easy open lids, and reminder alerts may look ordinary, but their cumulative power preserves brain function, stabilizes routines, and protects independence. Families who adopt these tools discover that many frightening memory changes fade once dosing errors are eliminated. But while tools prevent everyday slip-ups, not every change can wait for gradual adjustments. Certain symptoms signal urgent concern, requiring action within hours, not days. Recognizing when confusion or behavioral changes demand immediate attention becomes the next critical skill for families to protect both brain health and overall safety. When to call the doctor immediately. What matters most in urgent situations is knowing exactly when watching and waiting is no longer safe. Families already recognize that many forgetful moments can be monitored over time, but some symptoms signal danger and require immediate medical action. The question is not whether confusion is happening, but how fast it appeared and what else is happening with it. Quick recognition in these scenarios prevents permanent harm and, in some cases, can save a life. One of the most important warning signs is sudden confusion or disorientation. This is not the gradual progression familiar in dementia, but a rapid disruption in awareness that can occur in hours or days. A senior who cooked breakfast with ease yesterday may seem unable to remember how to use the coffee maker this morning. That abrupt shift is what doctors classify as delirium, which is formally defined as a sudden disturbance in attention and awareness. Drug-induced delirium is a medical emergency. Unlike the slow decline of chronic disease, this abrupt change means the brain is under acute stress, often from medication interactions, infections, or withdrawal. Families should not wait for a routine appointment. They should seek immediate care. Another urgent indicator is the appearance of hallucinations. Hearing voices, seeing things that are not there, or insisting on events no one else observes are not normal parts of aging. Hallucinations may result from certain medication buildups, alcohol effects, or withdrawal states. Because they feel real to the person experiencing them, hallucinations create risk of unsafe behavior, falls, wandering outside, or reacting to imagined threats. Any new onset of hallucinations should be treated as an emergency, not something that might fade on its own. Medical evaluation is required to determine the cause and stabilize the situation. Seizures and shaking also fall into the category of immediate concerns. Families may witness trembling hands, uncontrolled muscle activity, or even full convulsions. These episodes often indicate that the brain is reacting to severe chemical imbalances, alcohol withdrawal, medication toxicity, or combined effects of substances. Watching at home is unsafe because seizures can escalate quickly and compromise breathing or consciousness. Prompt emergency care is essential for stabilization and for preventing long-term injury. Alcohol withdrawal specifically deserves its own caution. Seniors who stop daily drinking suddenly after years of alcohol use may develop tremors, sweating, agitation, and rising blood pressure within hours. Without medical supervision, the process can progress to seizures or delirium tremens, marked by severe confusion, vivid hallucinations, and high risk of complications. Families should remember one simple rule. If a loved one has recently stopped drinking and begins showing agitation or tremors, seek immediate medical help. Withdrawal at home is not safe. It requires professional care to guide the body through the process without catastrophic outcomes. Combinations of alcohol and medications also create emergencies. When sedatives, sleeping pills, or opioids mix with even small amounts of alcohol, their effects become multiplied. Seniors may become unresponsive, experience slowed breathing, or suffer falls caused by intensified sedation. These effects can come on suddenly, long before family members expect it. The correct response is not to let the senior sleep it off, but to treat the event as urgent. Central nervous system suppression places life at risk, and hospitals are equipped to reverse or stabilize these effects. To help families respond quickly in real time, a practical checklist makes decisions clearer. Call emergency services or go to the ER if 1. Confusion or disorientation appears suddenly. 2. Hallucinations start without prior history. 3. Seizures or uncontrolled shaking occur. Or 4. Strong withdrawal signs emerge. Tremor, sweating, severe agitation, or sharply elevated blood pressure. These situations share one quality. They indicate the brain is overwhelmed in the moment. Waiting or second-guessing can mean missing the window for recovery. Families sometimes worry about calling too often or inconveniencing doctors. It helps to view brain symptoms like chest pain. If a senior suddenly clutches their chest, nobody hesitates to seek help. The same urgency applies when orientation shifts dramatically or when a loved one sees or hears things that are not there. Physician groups and emergency clinicians expect these calls. Sudden behavioral changes are treated as serious medical events. The brain deserves the same rapid protection we instinctively give to the heart or lungs. It is also important to remember that sudden confusion is not always caused by substances alone. Poor kidney function, new liver problems, or infections in older adults can cause medications to build up dangerously in the bloodstream, producing confusion, tremors, or hallucinations. These are biological alarms signaling that the body's systems are struggling. Only professional evaluation and testing can identify whether the cause is chemical, infectious, or neurological. What family members can reliably recognize at home is the timing and scale of change, which dictate urgency. Some families hesitate, wondering if the symptom could resolve overnight. This is where the rule of rapidity matters most. Gradual decline belongs to dementia. Acute change belongs to delirium or a similar emergency state. Delirium demands immediate medical assessment because, unlike permanent dementia, it can be reversible if treated in time. Doctors can identify causes, adjust medications, treat infections, or begin detox protocols as necessary. Early recognition by families gives medical teams the opportunity to preserve brain function and restore stability. The benefits of quick action are significant. Seniors treated promptly for drug or alcohol-related delirium often recover much of their clarity within hours or days. Orientation returns, attention stabilizes, and frightening symptoms disappear. Delayed recognition, however, risks permanent damage. Brain cells exposed to toxic levels or repeated seizures may not fully recover. Families who intervene quickly give their loved ones the best chance to return to baseline functioning instead of living with permanent loss. Knowledge of these warning signs turns uncertainty into decisive action. Families trained to recognize sudden confusion, hallucinations, seizures, and withdrawal symptoms know these events require immediate professional help. No one expects relatives to diagnose whether the cause is alcohol, drugs, infections, or metabolic issues. What truly matters is matching the urgency of the response to the severity of the event. Correct identification and fast action can mean the difference between temporary disruption and irreversible decline. In practical terms, the guidance is simple. Sudden brain changes are emergencies. They do not belong on a "to ask at the next appointment" list. They demand the same speed of response you would give to chest pain, stroke symptoms, or difficulty breathing. Thinking of them in this way prevents delay and supports better outcomes. Families who follow this approach not only protect their loved ones medically, but also preserve options for recovery. When help comes quickly, many seniors return to clarity once substances are adjusted, removed, or carefully managed. Recognizing the line between watchful observation and urgent response ensures that prevention and hope remain possible for the future. And once the immediate risks have been addressed, another critical question naturally follows. Are the memory changes permanent, or can the brain find its way back to sharper function again? Hope and recovery. The brain can heal. Recovery is possible, and the brain often proves far more resilient than people expect. Many changes that look frightening at first can be moderated or even reversed once harmful substances are reduced or removed. In clinical practice and published studies, doctors report that older adults who cut back on alcohol or undergo careful medication adjustments often regain sharper thinking, steadier moods, and more reliable memory. These improvements demonstrate that decline is not always permanent and that the brain, even late in life, has meaningful capacity to heal. One of the most powerful signals of this resilience comes from research on alcohol-related brain damage, often abbreviated as ARBD. Large reviews show that many people with ARBD who receive proper support and remain abstinent experience partial or even full recovery. This finding runs counter to the long-standing belief that once memory slips, it cannot return. Instead, the data show that function often improves once the underlying chemical stress is removed. For families, that means a sudden diagnosis of dementia doesn't always close the door. Sometimes it points to a process that can be influenced. The scientific term for these improvements is plasticity. The aging brain retains plasticity, so removing harmful substances often allows function to improve over weeks or months. Even if the changes are not immediate, the brain adapts, recalibrates, and strengthens existing pathways that were previously being muted. In practical terms, this means that someone who once struggled to follow conversations may, after an adjustment in medications or reduction in alcohol, find themselves participating more easily again. The improvement is not magic. It is simply the brain doing what it can when barriers are lifted. Doctors frequently see this play out. Clinical experience, supported by research, shows that seniors presenting with dementia-like symptoms often improve after medication lists are carefully reduced or reorganized. Likewise, older adults who reduce or stop long-term drinking often report clearer mornings, better balance, and steadier memory. These improvements are not always immediate and are usually gradual, but the pattern repeats often enough that it is recognized in both the medical literature and day-to-day practice. Timelines for recovery vary. For some, sharper alertness appears within days of stopping a sedative or reducing alcohol use. For others, improvements arrive more slowly, stretching over months as the body restores balance. Families should expect variability. Some seniors find that mood brightens first, followed by better memory and attention. Others notice clearer recall right away, but need more time to stabilize their organizational skills or decision-making. This variability reflects individual differences in health, age, and the duration of substance exposure. What all successful recoveries share is patience and consistency, time for the body to adjust, and repeated reinforcement from a stable routine. Not every symptom will resolve, and it is important to balance hope with realism. Neurodegenerative conditions do exist, and not every sign of decline can be undone. However, the possibility of partial recovery offers a shift in perspective. Instead of assuming that every memory gap is permanent, families and seniors can recognize which changes may respond to altering medications, managing alcohol, or improving sleep. This reframe not only gives direction, but helps reduce unnecessary fear. Everyday examples highlight the difference this makes. Clinicians describe older adults who appeared ready for long-term memory care, but after substance use changes, regained enough clarity to manage daily routines independently again. Others who stopped combining alcohol with sedatives reported steadier moods, better nights of rest, and improved social engagement. These reports are not isolated stories, but well-documented patterns that medical teams see regularly. They illustrate the gap between symptoms caused by ongoing pressure on the brain and those caused by irreversible illness. Families also benefit from recognizing that improvements do not require dramatic interventions in all cases. Many recoveries begin with small shifts, removing a nightly drink, adjusting a prescription dose, or replacing a sedative with a safer alternative. Each adjustment reduces the chemical burden, giving the brain the room it needs to stabilize. Over weeks and months, these adjustments build into larger changes, more consistent recall, sharper attention, and a greater sense of independence. The process of regaining clarity has emotional benefits too. Seniors often describe relief when foggy mornings lift or when participating in conversation becomes easier again. That relief translates into renewed confidence, which further strengthens outcomes. Instead of withdrawing from social activity, they re-engage. Instead of feeling trapped by decline, they regain agency by participating in their treatment and daily routine. Medical teams emphasize this positive cycle. Improvements in cognition support improvements in mood, which in turn support healthier behaviors. Families are key partners in maintaining this momentum. Patients may make the initial adjustment, but long-term support often comes from those around them. Encouraging routine, celebrating progress, and reminding seniors of the visible improvements all help sustain change. Even when recovery is slow, small signs, better recall of conversations, fewer missed appointments, improved mood, deserve recognition. These signs prevent discouragement and demonstrate that forward progress is still happening. Clarity about expectations is essential. Recovery means improvement, not perfection. Some memory gaps may persist. Some habits may take repeated efforts to change. But in many cases, reclaiming even partial function dramatically improves quality of life. Being able to manage finances again, remember appointments, or safely socialize without confusion restores independence and dignity. For many older adults, these wins feel even more significant than full recovery because they represent the difference between dependence and control. One other point emphasizes why recovery is worth pursuing: safety. Even moderate improvement reduces risks of falls, medication errors, or avoidable hospitalizations. As the brain stabilizes, movements become safer, judgment sharpens, and response times improve. These practical changes relieve pressure on families, reduce costs, and allow seniors to remain at home longer if that is their preference. In this way, cognitive recovery is not only about memory, it is about protecting overall health and maintaining independence. Healthcare teams reinforce recovery through structured steps such as medication reviews, safe withdrawal protocols, and follow-up monitoring. Each step protects against setbacks and builds stability. Families who remain informed about these processes know when to expect changes, when to be patient, and when to request. Professional input, coordinated care, increases the likelihood that improvements last and reduces the chance that setbacks are mistaken for inevitable decline. This hopeful perspective does not mean ignoring the challenges of aging. It simply means giving the brain the best possible chance to function at its peak, even late in life. Removing unnecessary barriers, offering medical support, and allowing time for plasticity to work can make the difference between years of confusion and years of stability. Families who approach this stage with cautious optimism and persistence often experience better outcomes than they imagined at the start. The larger picture is simple but powerful. The aging brain can heal. It may not return to its younger version, but it can improve when given the right environment. That message shifts the question from despair to possibility. Instead of asking how fast decline will happen, families can ask what steps encourage the clearest thinking still possible. And once the immediate factors such as alcohol and medication are addressed, attention naturally shifts to the daily choices that either strengthen or weaken recovery. What habits define how the brain functions each day? And how can seniors build routines that keep progress steady? Daily habits that protect senior brain health. Beyond medical care, everyday routines play a central role in supporting the brain. The choices seniors make repeatedly shape whether mental clarity holds steady or slips into fog. Daily habits may seem ordinary, but they provide strong protection, and major health organizations, including the American Psychological Association and leading geriatric research groups, consistently recommend exercise, social connection, and regular sleep as evidence-based strategies to protect cognition and lower risks tied to substance use. These aren't drastic measures. They're small, repeatable actions that, over time, help the brain stay sharper and steadier. Movement is one of the most important defenses for brain health because circulation directly fuels neurons. Physical activity increases oxygen and nutrient delivery, keeping thinking clear. For many older adults, this can be as simple as a 10 or 15-minute walk after lunch, working in the garden, or stretching during a television program. What matters is not intensity, but consistency. A short movement routine every day helps preserve balance, mood, and memory. Skipping activity for long stretches lets the mind and body drift towards sluggishness, while steady action keeps both engaged. Hydration is another simple but essential habit. As people age, thirst cues become weaker, which makes older adults more susceptible to drinking less without noticing. Even mild dehydration can bring headaches, confusion, and fatigue that mimic early dementia. The fix is straightforward. Build hydration into routine instead of waiting for thirst. Keeping a cup on the end table, refilling a small water bottle in the morning, or drinking tea alongside meals makes intake automatic. Seniors don't need large amounts at once. Steady sipping throughout the day keeps the brain's signaling systems working reliably. Eating patterns also matter because the brain depends on stable sources of energy and nutrients. When meals rely heavily on processed snacks and sugars, energy spikes and crashes intensify confusion. In contrast, balanced meals with vegetables, fruit, lean protein, and healthy fats provide what brain cells need to function steadily. Simple adjustments carry a big impact. Preparing smaller meals more often, keeping fruit or nuts handy for quick snacks, or adding one extra serving of vegetables helps close nutritional gaps that are common with aging. These micro steps maintain energy, prevent dips in concentration, and support brain cell structures over time. Sleep is one of the strongest predictors of memory quality. The brain processes and stores experiences during rest, and without those hours, learning remains scattered. Many seniors struggle with fragmented nights, sometimes from medication effects or changing sleep cycles. Small actions can reduce that disruption. Going to bed and waking up around the same time, darkening the bedroom, or limiting heavy meals late in the evening are realistic adjustments. A short nap during the day can help, but should not replace solid nightly rest. Protecting sleep in this way protects memory at the same time, creating a foundation for clearer mornings and steadier attention. Engaging the mind keeps neural connections strong, and the activities do not need to be elaborate. A short crossword, a word search, or 15 minutes of a puzzle game provides the brain with the stimulation it needs. Practicing a craft, rereading a favorite book, or learning to use a feature on a smartphone also demands attention in a way passive television does not. Even one short session of mental engagement daily exercises recall and problem solving. Seniors benefit most when these tasks feel enjoyable rather than forced, which ensures they become a sustainable part of routine. Social interaction adds another dimension of protection. Isolation narrows opportunities for memory use, whereas conversation forces the brain to listen, respond, and recall past information. Seniors can gain this benefit in accessible ways, phoning a friend once a week, chatting with neighbors during a walk, or attending a community class or club. Even brief social contact improves mood while exercising cognitive skills. Importantly, these connections reduce risks tied to loneliness, which studies link to both cognitive decline and substance misuse. Staying socially active ensures the brain continues to adapt to unpredictable, stimulating environments. The common thread linking movement, hydration, nutrition, rest, mental tasks, and social connection is routine. One skipped meal or missed walk is not damaging by itself, but regular gaps erode stability. The brain thrives when these supports are repeated day after day. Families can make consistency easier by keeping water visible, planning structured walk times, or encouraging shared meals. Instead of treating these habits as work, they can be folded naturally into daily rhythms, so they feel less like obligations and more like ordinary parts of living. Small examples underline how realistic this can be. 10 minutes of walking after lunch strengthens circulation. Keeping a filled water glass beside a chair prevents tiredness from dehydration. Snacking on a handful of almonds provides healthy fats the brain depends on. Turning off the television 30 minutes before bed supports better sleep quality. Doing a crossword or puzzle 2 or 3 times a week, or making a phone call to family keeps cognitive skills sharp. These are minor steps, but when kept steady, they build protection stronger than occasional, intensive efforts. A short metaphor captures the idea without slowing pace. Think of the brain as a garden. Movement streams nutrients in like water through the soil, meals supply the minerals, hydration keeps everything alive, puzzles prune and strengthen structures, and social contact adds light. No one day changes the outcome, but daily care builds strength across months and years. Families can reinforce these habits by joining in, going for a walk together, cooking a meal side by side, or solving puzzles together keeps the mood light. Instead of issuing instructions, relatives become partners in the process. The home environment can also be designed to support success. A pitcher of water within reach, puzzle books near the table, or a calendar by the bed to reinforce sleep times. These subtle cues reduce the need for reminders and encourage independence. For seniors, the aim is never perfection. It is not necessary to exercise heavily, drink liters of water, or maintain ideal diets to see benefits. What protects brain health are steady, modest routines. 10 minutes of effort, 1 extra serving of vegetables, a consistent bedtime, or 1 social interaction a week each stack into meaningful protection. Over months, these gains shape whether decline accelerates or independence is preserved. By embracing these manageable steps, seniors actively reinforce their brain health at home. These habits complement medical care and medication management, forming a second layer of defense for memory and mental clarity. The most important principle is reliability, built into daily rhythms. These practices reduce the fear that decline is inevitable and replace it with practical confidence. And once families recognize the potential of these small but steady steps, another truth becomes clear. Many memory changes are not fixed at all, but preventable or reversible with the right choices. Not every instance of forgetfulness in later life signals permanent decline. Some memory problems can be prevented, and others can improve when alcohol or medication is the underlying cause. Research shows that many medication and alcohol-related memory issues are reversible if caught early, which is why paying attention to timing and patterns is so important. The most supportive step families can take is to stay proactive. Note when lapses occur, keep a complete medication list, and don't hesitate to ask doctors or pharmacists for a review. A simple brown bag, check, where every pill and supplement is brought in at once, often makes problems visible that were hidden before. If this video helped bring clarity, consider sharing it with a friend or family member who supports an older adult's health. Encourage them to start by writing down a medication list and scheduling a pharmacist review. Simple actions like these protect independence, reduce confusion, and keep brain health stronger for longer. Thanks for watching, and take care of yourself and those you love.